This conference will now be recorded.
Welcome in, everybody. On today's lecture, we're going to be talking about abdominal and renal emergencies, which is going to be correlated with chapter 23 in your textbook. Now, this is going to be a very common occurrence as far as 911 calls where somebody is going to be calling for generalized abdominal pain. Now, for us as EMS providers, remember we are not going to diagnose in the field. However, doing a good, thorough patient assessment, patient history can start to steer us down the direction as far as what is ailing these individuals. And then also with that good patient assessment, we're going to be able to relay that to the emergency room, and then they're going to get that definitive care that they desperately need. So first, let's review some of the anatomy and pathophysiology of the GI system, and then also the renal system as well. So when we're looking at the abdominal cavity, which is going to be above the pelvic area, and then below the thoracic cavity, our peritoneum, this is going to be the lining that surrounds the abdominal cavity. So we got two layers, the visceral and the parietal. So visceral is going to refer to organs. Parietal is going to be in reference of the actual lining. And this is going to be important to remember as well when we start talking about pain. And then our retroperitoneal space, this is going to be behind the peritoneal space. So what we're concerned about here is our kidneys, because they're going to be located within this area. So they're very vulnerable to injuries being in that retroperitoneal space. So our quadrants and our regions, remember we are broken up into 4 different quadrants. Our left upper quadrant, and again, this is going to be referring to the patient's left and the right, not your left and right if you're assessing them face to face. So that left upper quadrant is going to contain the stomach, the spleen, the pancreas, and then also part of the large intestine. So the large intestine, this is actually going to encapsulate all the quadrants within that abdominal cavity. A right upper quadrant, liver, gallbladder, and then part of our large intestine. So when we're looking at the difference between the left and the right, we can see that the majority of the organs are in reference to the GI system, in which they're hollow organs with a heavy amount of acid in order to break down any food that's actually coming into the system. Now with the right upper quadrant, again, this is going to be in reference to our GI system as well, but they're going to have different properties, and oftentimes with our liver and our gallbladder, they're going to be solid organs containing a heavy amount of blood. So when we're looking at different injuries in between the left quadrant and the right quadrant, if we have a significant injury to the left, we got to be concerned about those hollow organs rupturing and then spilling that acid within that abdominal cavity. Right upper quadrant, what I'm very concerned about is injuries to the liver, in which we would have a heavy amount of internal bleeding from that injury to that organ. Now with our right lower quadrant, our appendix, part of our large intestine, and then also the female reproductive organs. Left lower quadrant, part of the large intestine again, and then female reproductive organs as well. And we're going to dive into our OBGYN later on in a few weeks, so we're not going to spend too much time discussing the female and the male reproductive organs. So here we can see different pictures as far as the quadrant breakdown. Again, very important that when we are assessing our patients that we're getting hands-on as far as conducting a physical exam, and then also viewing that as well. So we're looking for distension, any decap, ETLS, and then actually palpating all 4 quadrants to see if there's any pain or tenderness associated with that, and then also any rebound tenderness and pertinent negatives as well. So our types of structure, I mentioned this 2 slides ago. We have solid organs, which are going to be your vasculature, very large amount of blood, such as our liver. And then we also have vascular structures, which are going to be our large blood vessels, so our vena cava that's running through the center of our abdominal cavity. We also have hollow organs, so they are going to contain some type of substance in order to facilitate that breakdown of nutrients, and then also any food that's coming into the system. So with our pathophysiology of pain, and so this is really going to reference whether that pain is originating from the lining or from an organ. So we have mechanical forces, which could cause pain. So this is going to be blunt force trauma. We also have inflammation, and oftentimes we're going to see inflammation from a virus or a bacteria. So this is kind of our first line of defenses if there is, let's say, somebody suffering from appendicitis. So their appendix is inflamed as a result of that bacteria or that virus that's causing that, and it's going to swell up in order to try and create a defense mechanism against it. Ischemia is going to be in reference to a lack of oxygen. As a lack of that oxygen, we can start to see injury and or pain associated with that. So now we have two very discrete types of pain that oftentimes somebody is going to be complaining of. Visceral pain is going to be the organ itself which is involved. Oftentimes somebody who's suffering from appendicitis or a different type of organ associated with that pain, they're going to be describing it more of a dull pain. Now, when we're looking at the lining itself, that parietal pain, this is most often correlated to tearing pain. Now, remember, this isn't a catch-all rule or a golden rule by any means, but this can kind of steer you down that right direction when you are doing your patient history and patient taking. Referred pain, this could be pain that is felt elsewhere in the body. So very similar when we were talking about cardiovascular emergencies where somebody's suffering from chest pain, they might have shoulder pain or they might have jaw pain. The same thing, somebody who's suffering from some type of GI related issue might be complaining of back pain or hip pain. So now let's dive into the different types of abdominal emergencies that we're most often going to see. So peritonitis, this is going to be inflammation of the peritoneum. So we can see when we're referencing our medical terminology, anytime we see ITIS at the end of a word, that's going to be in reference to inflammation. So we can see the root word, perito, so that is going to be in reference to the peritoneum. Itis is going to be inflammation. Then you can break down that word and see that it is inflammation in the peritoneum. A variety of different causes can actually cause peritonitis. So this could be caused from blood or pus, bacteria, chemical substance, anything that leaks into that peritoneal cavity, then actually causes irritation to that. And as a result, that body is going to send defense mechanism and it's going to create that inflammation factor, or that inflammation factor is from the bacteria itself. Because of the inflammation, that's where we're going to see that associated pain. So our signs and symptoms that we're going to see with this: abdominal pain or tenderness. Could also see nausea and vomiting, diarrhea, lack of appetite, which is very common for all of these different GI issues, and then fever and chills. So the fever is going to be associated with that bacteria or that virus entering the system. Our body's natural defense against that is going to increase our body temperature in order to try and kill off that bacteria or that virus. When we're seeing this too, these signs and symptoms, we're going to see 90% of the same signs and symptoms for all of the different abdominal emergencies that we're going to see. So this is another assessment tool that we can utilize. This is going to be the heel drop test. So the patient stands up on their tiptoes, drops to the heels, and with a lot of these abdominal emergencies, they're going to be complaining of pain, but oftentimes they can't pinpoint exactly where that pain is originating from. Because again, it's going to be that referred pain, right? So if somebody has got some ailment with their liver and that pain is actually originating from that upper right quadrant, they might be complaining of abdominal pain in all four quadrants. Where we can use this heel drop test, once they hit the ground with those heels, that pain is going to be associated right to that upper right quadrant. So here we can see that inflammation and we can see the associated symptoms and signs because of that inflammation. So again, lack of appetite, we can see that. fever from that bacterial and that virus. And again, we can see that abdominal pain associated with it because we can see the small intestine is basically being pushed to the outer limits of the peritoneal cavity. Appendicitis, again, inflammation of the appendix. We can see the itis at the end of it. So this is going to be caused by a blockage in the intestine, and then as a result, it's going to be inflamed and extremely irritated. So a lot of pain associated with somebody is suffering from appendicitis, and other signs and symptoms that we can see: nausea and vomiting, a low-grade fever, and then also abdominal guarding. Abdominal guarding is going to reference the individual is actually going to bring their knees up to their abdominal area, and they're basically going to be comprised in that fetal position. This takes pressure and tension off of our abdominal cavity, and oftentimes somebody who's suffering from a GI issue will do that in order to alleviate some of that pain associated with it. So there we can see our appendix. It is the most retro aspect of our colon. So if somebody's complaining of this, and oftentimes they'll complain of very specific lower right quadrant abdominal pain. So a good question to ask somebody if they are experiencing signs and symptoms associated with this is if they have their appendix. So if somebody has severe appendicitis, oftentimes they'll actually go ahead and remove that because it is a non-vital organ in order to live. Next, we have pancreatitis. So this is going to be inflammation of the pancreas. So a couple of different varieties that can actually cause this. Heavy amount of alcohol, so our alcoholics out there are very prone to pancreatitis. You also see gallstones or our bacterial or virus infections. So some are signs and symptoms that we can see. Again, abdominal pain, vomiting. You can see mild jaundice too. Remember, jaundice is going to reference the yellowish tinge of the skin. Severe cases, they actually kind of look like one of the Simpsons characters. Also, specific to this, as far as signs and symptoms, we can see pain radiating to the navel area. So this, again, is kind of a hallmark sign when we are looking at pancreatitis. So there, good demonstration of what that pancreas is going to look like once it's inflamed. Oops. Cholestasis, this is going to be inflammation of the gallbladder and very commonly referred to the presence of gallstones. So gallstones basically are a buildup of calcium or different chemicals that create a blockage within the gallbladder and into the small intestines. So very painful. If anybody's ever experienced gallstones before, they remember it for the rest of their lives. Also, individuals are prone to gallstones as well. So oftentimes when you're conducting your physical exam and then also your patient history, they're going to be able to identify, yes, I've had gallstones before, and yes, this feels very similar to when I've had a gallstone attack in previous life. So our signs and symptoms that we can see, oftentimes this is concluded with a sudden onset of pain. Oftentimes in the upper quadrants, tenderness upon palpation, heavy amount of heartburn as well associated with this. So with that heartburn too, remember to do your pertinent positives and your pertinent negatives as far as cardiovascular emergencies. I'm much more concerned about something ailing the cardiovascular system than something associated with the gallbladder. So make sure that you're doing your history taking and steering down the cardiovascular system and also the GI system when you are doing this. So there, see your gallbladder, normal, and then inflamed. So then gastrointestinal bleeding, so this can occur anywhere within the GI tract. A lot of different causes, can be classified as upper or lower. So heavy amount of alcohol consumption can cause this. Tobacco use can also cause this, stomach ulcers, is another one that will produce gastrointestinal bleeding. And then think back to our different types that can cause that pain. So our mechanical forces, our shearing forces, our tearing forces, such as when we're involved in a motor vehicle accident. Our signs and symptoms that we can see, heavy amount of abdominal pain or tenderness. And then we can also see bleeding either from stool or from vomiting. So oftentimes when we associate an upper gastrointestinal bleeding, when somebody's vomiting, we're going to see more bright red blood because it has actually digested all the way through the GI tract yet. And then the same thing if it's an upper GI tract bleeding and they're having stool bleeding in their stools, we're going to see that coffee ground type substance when they are bleeding from there. Now, if somebody's bleeding from the lower GI system, it's going to be bright red blood. And then also when they're vomiting, then it's going to be the reverse. It's going to be that coffee tinged or a coffee ground style of bleeding. Depending on the amount of bleeding, we can see tachycardia. So that's going to be our first sign of our shock algorithm. Remember, if they're in that compensated shock phase, everything is going to increase at that point. So here we can see different types of upper and lower gastrointestinal bleeding. Esophageal varices, so these are going to be bulging or engorgement, weakening of the blood vessels in the lining of the lower part of the esophagus. So common in heavy alcohol drinkers or patients with liver disease. True emergency once these things burst. Once they do burst, they bleed a substantial amount. We also are looking at different airway issues associated with this. And then oftentimes these individuals are going to go into cardiac arrest very quickly. Signs and symptoms that we're going to see: large amounts of bright red blood, absence of pain in the abdomen. Could also see a rapid pulse, difficulty breathing, and then jaundice. And again, that jaundice is going to be an associated factor with heavy alcohol consumption, and then that breakdown of that liver if they are in liver disease at that point. So gastroenteritis, this is going to be inflammation of the stomach and then also the small intestine. This is going to be caused by a virus or a bacterial infection. Signs and symptoms that we could see: again, abdominal pain, cramping, heavy amount of nausea, vomiting, diarrhea, and then we could also see fever and dehydration depending on if they've been properly eating and or drinking. So this is a picture of a variety of different viruses and bacteria that can actually cause inflammation of that small intestine or that stomach. Remember, we actually do have bacteria inside of our stomach and in our small intestine all the time, and this is reference to good bacteria. We actually need some form of bacteria in there in order to help the digestive tract actually go through its normal processes. Next, moving on to ulcers. So ulcers definition, we're going to be looking at open wounds or sores within the digestive tract. This could be caused by the breakdown of that lining. So the heavy amount of acid is actually going to cause that ulcer. Heavy drinkers actually are very prone to ulcers. Somebody who takes a daily heavy dose of aspirin, different medications can actually create that ulcer as well. And then stress as well is another proponent to ulcers. Signs and symptoms that we could see: sudden onset of that abdominal pain. Oftentimes this is going to be kind of a pinpoint pain located in the left upper quadrant. You could also see the generic GI symptoms as well, such as our nausea and vomiting. Hematemesis is reference to vomiting blood. So there we can see that ulcer. Within that, we can also see that acid escape out in that peritoneal cavity as well when we are dealing with an ulcer like this. Our intestinal obstruction, blockage, that's going to interrupt the normal flow of the intestinal contents within that intestine. We oftentimes see this with our geriatric patients because after the age of 30, our organ productivity actually goes down 1% for every year past that 30 mark. So when we're looking at a 70-year-old male patient, their organ productivity is 40% less than what it was at that 30-year mark. So as a result of that, the GI system does not flow our waste material as well. And that, oftentimes that's where we're going to see those intestinal obstructions. Signs and symptoms that we can see associated with this: abdominal pain, nausea, vomiting, abdominal distension, and then we could also see high-pitched bowel sounds. We're not going to talk too much about bowel sounds because this is more of a nurse skill or a ER physician skill. So when we're diving into our patient history with something like this, if we are anticipating some type of bowel obstruction, we should be asking this question for any individual who is experiencing abdominal pain. When's the last time you pooped? If they did, ask if there's any blood or anything abnormal within that stool movement as well. And then on to our AAA. So this is going to be our big one. If it is an actual AAA where it actually shears or balloons and tears away, then we only have minutes in order to get them to the emergency room. Their chance of survival is very unlikely if somebody actually has a complete AAA out in the field. So this is going to be a weakened or ballooned and enlarged area of the wall of the abdominal aorta. So when we're referencing back to our bleeding and shock, basically we can lose all of the circulating blood volume within our system in a very short amount of time. So causes, we can see tobacco use, hardening of the arteries, hypertension. Some signs and symptoms that we're going to see: gradual onset of the lower lumbar, groin, and abdominal pain. Oftentimes this is going to be described as tearing pain. It can be in the back, can be in the testicular area, and then we see a heavy amount of signs and symptoms of shock. So they're going to be pale and cool and diaphoretic. Oftentimes they're going to have a low heart rate and a low pulse if they're starting to go into that decompensated shock phase. So a lot of times people will actually have a AAA identified within the ER or within a normal doctor visit, and it just hasn't exploded yet or hasn't ruptured yet at that point. Where we get called is when it actually ruptures. So then with hematological emergencies, anemia, so this is going to be a reduction in the number of red blood cells. Remember what our red blood cells do is they carry oxygen on that hemoglobin to the rest of the body. So somebody who suffers from anemia, they don't have as many transport units within their system. You could also see sickle cell anemia. So this is going to be red blood cells, have an abnormal hemoglobin, and they don't carry that oxygen very adequate. So oftentimes somebody who suffers from sickle cell anemia is, instead of a nice round shape like a normal healthy adult for red blood cells, they're going to have a crescent moon shape. And because of that crescent moon shape, it makes it very difficult for that oxygen to actually bind to that red blood cell. Hemophilia is another one. We can see this associated with a blood disorder that affects clotting. So somebody who gets into a traumatic event, or let's say our OB patient, they're going into active labor, there's going to be a heavy amount of blood associated with that. Their body does not recognize the fact that they need to send that clotting agent in order to create that stop the bleed formation within their defense mechanism. So there we can see difference between our normal healthy blood cells and our sickle cell anemia. We also see with sickle cell anemia, oftentimes we can get those red blood cells to group together because they don't slide by very well within the blood vessels, and they can actually create issues with that. We are going to skip over our gynecological emergencies because we are going to talk about this during our OB issues. Now on the renal emergencies, so UTI is very common emergency that we're going to see infection within the urethra, bladder, ureters, and kidneys. This is going to be caused by bacteria. Signs and symptoms that we're going to see: abdominal and pelvic pain. Could also see blood in the urine, pain, burning from urination, and then also flank pain. Could also see an altered mental status with this, especially with our geriatric patients, because of that high spike of that fever. Kidney stones. Now we talked about gallstones previously. Kidney stones, again, very, very painful, and somebody who's prone to kidney stones oftentimes is going to be able to tell you whether this is kidney stones from previous experiences. But this is going to be caused by crystals formed within metabolic abnormalities. So a heavy amount of calcium, heavy amount of sodium, something along those lines will actually cause those crystals to be formed. And it's very difficult for those individuals to actually pass that kidney stone. Signs and symptoms that we're going to see: abdominal pelvic pain, flank pain, groin pain, abnormal urine color, fever, chills, and then also nausea and vomiting associated with that. So there we can see the ureter, where we're going to pass our urine, and then we can see that individual is trying to pass that stone. So we can see, it's going to get stuck in there, heavy amount of pain, not much that we can do for this besides get them into the hospital. Kidney failure. So kidneys fail to function adequately at this point. Remember, we do have two kidneys. Some individuals are only born with one. Causes could be a decrease in urine elimination, diabetes, and hypertension. Our signs and symptoms that we're going to see: blood in the urine, altered level of consciousness. We could also see a heavy amount of pedal edema, so fluid buildup around the ankles and the feet. This is from that fluid shift not being adequately passed through the system. So there's a difference between our normal kidney and our diseased kidney. Remember, these kidneys too, they sit in the back retroperitoneal space of that abdominal cavity, so they are very prone to injuries as well. So we talked about a variety of different GI issues, renal issues, and hematological issues. All of those signs and symptoms are very, very similar to each other. With EMS, what we want to do is do a good, thorough patient assessment, get a good patient history so that we can relay it to the emergency room and that emergency room staff so that they can do the proper testing and diagnosis. I mean, with GI issues, we're going to treat a lot of these individuals the same. We're going to treat for shock. We're going to make sure that they're comfortable, and again, do a good, thorough patient assessment and get those individuals to the hospital. Thanks, everybody.